Hello everyone. Do you know, as per the WHO, the World Health Organization, cervical cancer is the fourth most common cancer among women globally, with an estimated 600,000 new cases and 300,000 deaths only in 2020. About 90% of the new cases and deaths worldwide in 2020 occurred in a low and medium income countries. This cause is so close to my heart that I am doing a campaign called Save Daughters in March 2024 to bring awareness and to get 1,000 girls vaccinated to prevent cervical cancer. Today we will focus on cervical cancer prevention awareness. I want all girls across the globe to be safe, healthy, and happy. Today we have a special guest, Dr. Anu. Dr. Anu is a renowned gynecologist with more than 20 years of experience in India and the UAE. She is the one who guided me on cervical cancer prevention and helped me and my mom to get vaccination for the last year. I welcome you, Dr. Rana.
Thank you. Thank you, Pragya.
You're welcome. So, for the first question, can you please explain what is cervical cancer and what makes it so dangerous?
See, as stated by Pragya, cervical cancer is the fourth most common cancer in the women. So, what is the cervix? Cervix is the lower part of uterus which connect uterus to the vagina. Okay, cervical cancer. There are some abnormal cells that grows in the cervix, and later on they lead to cervical cancer. This is very dangerous cancer. It spreads very fast and it is diagnosed at very late stage.
Oh, okay, so it's quite severe, and like lots of people do know about this, so we need to bring more awareness. So, for the next question, what age groups does it impact the most?
Mostly when we diagnose cervical cancer, women are at the age in the 40s and 50s.
Oh, okay. So, like,
Cervical cancer, yeah, yeah.
so like, does it only impact people in age of 40 and 50, or can it like come like in 20 and 30 and all that?
Yeah,
Can
rarely it can affect 30s, but most common age group is 40s and 50s.
also like
Actually,
it impact?
cervical cancer is caused by a virus, human papilloma virus. That virus affect at the age group of 20s and 30s most. So cervical cancer is diagnosed more in the 40s and 50s.
So it impacts a wide range of women, and it's important to know that so we can get vaccinated. Vaccinated.
Yes,
So
yes.
I received both of my prevention from HPV, and if you can explain to our audience about the vaccination in more detail, would be great.
See, there are two types of vaccines available for the cervical cancer. Actually, these vaccines are against human papilloma virus, that virus that causes cervical cancer. One is Gardasil and one is Cervarix. Gardasil vaccine, it's Gardasil 9. It works against 9 type of human papilloma viruses. And second is Cervarix that will work against 2 type of human papilloma viruses. So definitely Gardasil 9 is better. And for the age group between 10 to 15, we give 2 doses. And between 15 to 45, we give 3 doses.
Okay. Okay, so I'm very glad that I received my vaccination and will continue spreading awareness. I'm sure it makes an impact. So in March 2024, I'm starting a campaign called Save Daughters, where I'm going to be vaccinating 1,000 girls in March. I've been working on this cause for the last 1 year, and during my research, when I was asking parents, the two main challenges that stops getting their daughters vaccinated was number one, there was a lack of awareness. Like they did not know what this cancer was, and they did not know the vaccination. And the second one was the cost of the vaccination. So in my campaign, Save Daughters, I'm focusing on these two main challenges. I'm so glad to see so many hospitals and clinics are coming forward to offer great discounted rates for consultation, screening, and vaccination to support the campaign. So, for our next question is, how can UAE residents get the vaccination?
UAE residents can go to any hospitals or clinic and they can get vaccination.
So, like,
They should meet gynecologist.
okay, so any doctor cannot give, only a gynecologist, a special doctor.
Any doctor can give.
Oh, okay. So, can this HPV virus impact boys as well?
Yeah. So nowadays recommendations are coming. We should vaccinate boys also.
Oh, okay. So it's quite shocking to know because lots of people only think that this is for girls, but now it's more frequently and all it's also coming for boys. So
The
as this is
human papilloma virus can affect boys also.
oh, okay. So as this is the fourth most common cause of virus among women across the globe and vaccination is available, how can we motivate and spread awareness to parents to get their daughters vaccinated?
I think we can start at the school level. Second, you are motivating. Third, like any parent, any patients coming to the hospitals, we can motivate them.
Oh, okay. So like I under
Videos, yeah.
so I understand awareness is the key, and we must, talk about it more openly because when people don't know, then there's a higher risk of them getting cancer when they are in their 40s or 50s, right?
Yes.
So, I have great news. To reach this threshold by the end of the 21st century, WHO has set up the 90-70-90 targets to be reached by 2030 and to be maintained. So 90% of girls will be fully vaccinated with HPV by age of 15. 70% of women are screened with high performance tests by 35 and again will be screened at 45, and 90% of women identify with cervical cancer will receive treatment. So, thank you so much, Dr. Anu, for bringing awareness on this important topic. It will like inspire so many parents when they see your interview and they see this interview because now they understand why they should get their family vaccinated. So, thank you for your time, first of all.
Thank you. Thank you for inviting me to such a
Yeah.
noble cause.
So thank you everybody. To also for my campaign, if you to see more, you can go to my LinkedIn, Instagram, and YouTube for more information about it. Thank you everybody, and I hope you enjoyed.